Gelobt sei Jesus Christus. Folgen 2 Videos von Ärzten ohne Grenzen, die im Gaza zurzeit helfen. Wir teilen dies mit euch, weil im deutschen Sprachraum sonst fast nichts über die wahre Bosheit veröffentlicht wird, die im Gaza zurzeit von dem zionistischen Regime Israels begangen wird.
Working with the NHS in London, I've been volunteering in Gaza for a number of years, and we have just this minute arrived back from our latest visit.
What did you see in Gaza this time that may have been different to other times?
Well, what we saw is the most appalling humanitarian catastrophe of our young century, and we were all appalled by it, but at the same time privileged to be able to be there to lend a hand and support our brilliant, professional and disciplined Palestinian colleagues who have now endured nearly 20 months.
How would you describe what you saw in Gaza?
I think it's very simple. It's mass murder and mutilation. We hear people talking about durable solutions, but every day up to 100 Palestinians find their own durable solution because they've been killed.
What do you think that does to a population?
The Palestinian population in Gaza is absolutely remarkable because after a bombing they pick up their tools and they clean up. Where we've been, we see lots of patients every day. Our daily business begins with a lullaby of bombs from about 5 o'clock. We start work at between 8 and 8:30, and we see a stream of wounded people through the day. And of course, every wounded person comes from a group. There's no person, virtually no one, is wounded in isolation, so that we often see simply the remnants of large families, and that is extremely tragic.
Do you feel a sense of frustration that the world isn't doing enough to stop this? And what would your message be to governments who can do something?
I have been in the past, but I know that the worldview is changing. But what we want to see is action as well as words.
Joined by Dr. Abdul Basit Khan, who is a neurosurgeon volunteering with Rama Worldwide at the Nasser Hospital in Khan Yunis. He's an American doctor volunteering in Gaza right now. Thank you so much for being with us, Doctor. I understand just before we went to air, there was another bomb right near you?
Thank you, Amy. Yes, in fact, there were 4 bombings just south of the Khan Yunis complex while we were joining the phone call. These are residential areas, indiscriminate bombing, and I'm sure after this call, I'll go treat the patients in the emergency room.
And Dr. Khan, some of the patients that you've been treating, could you talk about the injuries they're suffering?
Yes, definitely. So I'm a neurosurgeon. I treat brain and spine pathologies. That was just another bomb. I've been treating mostly blast injuries. My patients are all dislocated and living in tents. They are being indiscriminately bombed by the Israeli occupation forces. My first day here, within 2 hours of arriving, I operated on a 10-year-old girl who was in her tent and was struck by a bomb. Father said he was outside of the tent. A bomb came from the sky. She became immediately unconscious. Came to me. She had shrapnel going through both, ripping through both frontal lobes. I operated on her that night. Thankfully, she's doing well. These types of bombings affect entire families. I was later consulted on an adult woman in the ICU who had shrapnel penetrating the front of her neck, causing a large neck hematoma. I was consulted by the head and neck surgeon because there was shrapnel lodged in her spine. That woman turned out to be the mother of the patient I had just operated. The poor father is here going between both ICUs. These kinds of conditions and these kinds of scenarios are very common. In fact, just before I logged into this call, I took care of one young boy, 8 years old, similar story. In the tent, he has shrapnel ripping through both frontal lobes. We will soon operate the patient as soon as we have an operating room available. Everything is in resource limitation in Gaza. Then later in the emergency room, I took care of his father, who also had shrapnel injury to the back of the head. These are the kinds of patients I'm seeing.
A few days ago, Haaretz, the Israeli newspaper, reported that Israeli soldiers, IDF soldiers that they've interviewed, said that they were ordered to fire on unarmed crowds near food distribution sites. There have been over 500 Palestinians killed since May at these food distribution sites. What are your other colleagues talking to you about the kinds of people who have been killed or wounded by gunfire at these distribution sites?
It's an excellent question. The injuries from the aid sites are very common, and we're seeing these injuries every single day. I myself, yesterday night, we had a patient come from the aid site in a delayed fashion after he was struck with shrapnel in the back of the head. The day prior, I had seen a 25-year-old man who had a single gunshot wound with a high-velocity rifle, entrance in the posterior aspect, back of the neck. They shot him in the back of the neck, and it exited the front part of the chest. It severed his spinal cord. He can no longer move his arms or his legs, and he will remain like that for the rest of his life. He's only 25 years old. I reviewed with my colleagues the cases that they're seeing. One of the cardiologists here, he saw a patient who had been shot in the chest at the aid site, had blood collecting around his heart, preventing his heart from beating. They had to emergently drain the bleeding from around the heart. One of my colleagues is an orthopedic surgeon. Yesterday, he amputated 3 limbs of different patients, young, healthy civilian patients, just seeking aid. And as you can imagine, that's very morbid to lose an arm or a leg. My other colleague is a urologist. He took care of 3 patients yesterday who were all separate patients shot in the scrotum. 2 he operated on, and 1 he is managing conservatively. The one he's managing conservatively is a 7-year-old boy. A 7-year-old boy was with his father in the aid station and was shot in the scrotum. And unfortunately, one of my colleagues, the cardiologist, saw a patient who was dead on arrival. 7-year-old boy was shot, multiple gunshots at the aid station. So these cases are very common.
Just to be clear, the medical charity, Doctors Without Borders, is saying that this Israeli-U.S. food distribution scheme in Gaza is degrading Palestinians by design, forcing them to choose between starvation or risking their lives for minimal supplies, with over 500 people killed, nearly 4,000 wounded while seeking aid. MSF says, Médecins Sans Frontières, Doctors Without Borders, says this scheme is slaughter masquerading as humanitarian aid and must be immediately dismantled. Dr. Bassel Khan, you're a doctor. I know you can't talk about politics here, but you are seeing what's happening right there on the ground. Are your patients, those that are conscious, talking about having gone to get food?
Yes, so usually it's the young adult men that are going to get the food on behalf of the family. But like I said, even 7-year-old boys have gone with their families to attempt to get food. Beyond the patients, it's not just the patients, Amy. Even the doctors here are suffering from starvation. There's minimal food available. No one in Gaza is eating meat. I haven't seen one person eat meat since I've arrived. I'm talking to my neurosurgery colleagues who are native Palestinians living here and working here in Gaza. Their situation is very dire. One of the colleagues told me he lost 50 kilograms. That's almost 100 pounds since the start of the occupation and the war. There's food insecurity is rampant from all levels of society, from the poor to the, even the physicians are not eating. And this stretches to the patients as well. The 10-year-old girl that I mentioned, we operated on her the same night she came. Thankfully, she had a good neurological recovery. The next morning, I wanted to start her with tube feeding so she could get some nutrition to recover from her injury. I talked to the pediatric ICU doctor, who is a Palestinian native, who lives in Gaza, has been working here for the entire war. He said, yes, I agree with you. We should give the tube feeding, but it's not available. There is no tube feeding in the pediatric ICU for the 10-year-old girl in Nasser Hospital in Khan Yunis. It's not available.
Finally, Doctor, you are an American doctor who works in Houston. You're a neurosurgeon. What is it like to be there at Nasser Hospital in Khan Yunis for you? Does anything in your life experience compare?
No, definitely this is the worst thing I've ever seen in my entire life by far. I have been following the occupation since the beginning, and you read about the devastation, the destruction, the humiliation, the hunger, the starvation, the death, and it just does not do it justice. Everywhere you look, the hospital is overcrowded. Families are living in the hospital. The supplies to do the operations are limited. The Israeli forces will not allow you to bring such supplies in. We're using single-use items, for example, drill bits and such tools that you're supposed to dispose of after each use. They're not available, so we cannot dispose of them. We're reusing them and attempting to sterilize them. The operations that take me maybe 45 minutes to 1 hour in Houston are taking me 2 to 3 hours here in Nasser Hospital. Nasser Hospital itself was a victim of bombing. There's no windows in Nasser Hospital because they've all been destroyed. There's no windows, meaning the bugs come into the hospital. All of the operations I've done in the operating room, because there's no air filtration system left, there are bugs coming into my operating field. This situation is so dire and so unacceptable. I'm totally flabbergasted. At the same time, I have to really respect and recognize my Palestinian colleagues. I've only been here a short time. My Palestinian colleagues, the neurosurgery team here, they are themselves displaced from the European General Hospital, the European Gaza Hospital. They each have been relocated more than 7 times each. The doctors are living in the tents, but they still come here. Every other day, they take 24-hour calls, 2 teams. They have not been paid salary. And they have been managing these patients with such little technology, such little tools, and they're managing them to a very high degree. So I really respect and admire my colleagues here. And no, this is the worst thing I've ever seen in my whole life.
Dr. Abdul Basit Khan, thank you so much for being with us, neurosurgeon volunteering at Nasser Hospital in Khan Yunis, speaking to him in Gaza. Although the Israeli military, the Israeli government, Netanyahu, the prime minister, does not allow international journalists to cover on the ground what's happening in Gaza unless they are embedded, you can see it is not difficult to speak to people on the ground.
Beten wir und tun Buße, so wie es Bischof Strickland in einem neuesten Schreiben uns anempfohlen hat, auf dass Gottes Gerechtigkeit eines Tages, spätestens im letzten Gericht, wiederhergestellt wird. Denn selig die hungern und dürsten nach Gerechtigkeit, denn sie werden satt werden. Selig die Barmherzigen, denn sie werden Erbarmen finden. Selig die ein reines Herz haben, denn sie werden Gott schauen. Selig die Frieden stiften, denn sie werden Söhne Gottes genannt werden. Und wehe all den Menschen, die sich der Bosheit und der Herzenshärte schuldig machen. Denn wer die Bösen rechtfertigt und wer die Gerechten verurteilt, ist ein Gräuel vor Gott. Sprüche Kapitel 17, Vers 15. Und unser Herr Jesus hat uns gemahnt: Meint ihr, dass nur sie Schuld auf sich geladen hatten, alle anderen Einwohner von Jerusalem aber nicht? Nein, im Gegenteil, ihr alle werdet genau so umkommen, wenn ihr euch nicht bekehrt. Und hören wir noch einen weiteren Arzt aus dem Gaza.
Joins us live now from Nasser Hospital in Gaza in Khan Yunis. Dr. Brauner, thanks so much for being with us. Can you describe the situation? Once again, we're reporting since midnight, 41 Palestinians have been gunned down. Yesterday, on Monday, Israeli forces killed at least 71 Palestinians, including 50 people waiting to receive aid. Can you explain, you have been treating some of the people who were injured. What are their injuries? What is happening?
Thanks, Amy. We're seeing a very predictable pattern. Shortly after the so-called aid distribution centers open, we hear ambulances flying towards the hospital, private vehicles, donkey-drawn carts bringing in people, streams after streams of people. They often have isolated gunshot wounds to their head, to their neck, in the very center of their chest. There's very high lethality, so a large percentage of the patients that come in are already dead. And then we kind of move quickly, transition quickly to the next patient. We're seeing lots of, children, adolescents, teenagers. We're seeing, some older people, but it's really more execution style than the typical blast injuries that we see, which tend to be more systemic, like head, neck, chest, and abdomen with shrapnel. And these are really isolated, targeted types of injuries that are much more consistent with the firsthand reports that we're getting. And a lot of the video that we're watching from the so-called food distribution centers where, it's kind of like a perverted Squid Games where they're given a certain period of time to get the aid. And if there's any chaos, then, they just start opening fire. And then we see it in our facility, 20, 30 minutes later.
And Doctor, the Speaker of the Palestinian National Council, Rawi Fatou, said that, he said, quote, "Never in the history of war have pain and hunger been turned into tools for mass murder, aid used as bait for death, and food distribution centers turned into arenas for mass executions." What are you hearing from these patients who live through this, or who are wounded by just trying to get food?
Yeah, well, they're very aware of the risk. They sit down and, contemplate the risk of going. And, we often will see teenage boys who, want to be heroic for their family and end up going. They are hypervigilant, and they are, extremely afraid, and they approach with caution, and they're constantly looking for potential areas to dive under in case shooting starts. So it's this really grotesque, frenetic, situation. And and it's just, they're trying to generate fear, which is part of it, but it really is sort of like displacement by death. And I did a little bit of research myself. I'm not an expert in this area, but I don't think this is, this has never been experienced before in modern history that I can tell.
Now, you've worked as a volunteer previously in Haiti and Mozambique and rural Mexico. Yeah. How does Gaza compare?
Well, quite frankly, all of these other situations, I think, right after the earthquake in Haiti, things were pretty chaotic, but, Mozambique was, sort of during their early Renaissance and, 6-7 years ago, and things were, really calm and beautiful and growing. So, I haven't been in the military, and, so I knew intellectually that I was going to a war zone, and I knew the risk, and I was, quite frankly, very afraid. And what I've experienced here, I feel relatively safe at Nasser Hospital, but it is just, nothing can prepare you for this. I've seen a lot of trauma in my life, but I haven't seen 50 in a day. I haven't, pronounced 20 dead people in one shift before. There's nothing that can prepare you for this. I was also worried that the intensity of this was going to hurt me, and I was going to have PTSD, and I kind of thought about things that I could do to, attenuate that kind of injury when I get home. But, instead, it's been a really uplifting experience meeting, my nurse and physician, allied health colleagues here at the hospital, and, working with them kind of day and night with, one mass casualty after another, and, working really arm to arm and seeing the resilience and the joy and the love that still comes through.
3-year-old Hassan Barbak died earlier Monday after suffering kidney and liver damage amid soaring blood acid levels due to acute malnutrition. The boy's brother also previously died of hunger. The reports are their family had urgently appealed to transfer the children for treatment, but Israeli authorities denied their request. Can you talk about this issue of hunger? And also, UNICEF warning Gaza is facing what amounts to a man-made drought with children at risk of dying of thirst?
Yeah, absolutely. I was really fortunate enough to personally meet, we've been euphemistically calling baby Hassan because, he was really 3 years old, but he weighed less than half of what his normal body weight should be. He had a complicated metabolic disorder. But he really wasn't dying from his complex medical, diseases. He was dying from the policy of not opening the borders and getting food in. He died as a direct result of that. And we actually my 3 U.S. colleagues and I, when we met Hassan a few days ago, we looked at each other and we said, we've got to do something about this. It was so compelling. Within 30 minutes, we got the domain name gfc25.org, the Gaza Formula Countdown, for 48 hours. And we started making a very amateurish but heartfelt, plea to the world to try to get in formula, and we were not successful, and baby Hassan died. And the campaign that we built was, in retrospect, a little bit, amateurish and half-baked, but, there were just 4 American physicians sitting there with this child and feeling, compelled to do something. And what we did wasn't enough, but we're going to continue to kind of build on this and, to demand the opening the borders to food, a specialized formula. So the Freedom Hospital, which is just adjacent to Nasser, they've got 100 children at risk, and these children are at risk day to day because they never get a month's worth of food in. They get a day or 2 days or 3 days, and so there's so much stress, unnecessary stress that occurs because of this situation. And we need sustainability. We need to work policy, but this is a much more than a policy level thing. This is like a humanitarian issue, and we need to open the borders to food. But as far as the scarcity of water, that is, I believe it. Humans can go months without food, but we can only go 3 days without water.
An alle Zuschauer, bitte unterschreibt auch die Petition, die wir in der Videobeschreibung verlinkt haben, von Ärzte ohne Grenzen an die deutsche Bundesregierung, damit diese endlich ihr komplizeshaften Schweigen und ihre Mitschuld beende und handle, indem sie Stellung bezieht und Druck ausübt auf die internationale Politik, auf Amerika, auf Israel. Denn jede einzelne Stimme ist wichtig. Wenn die Politiker ihre Autorität missbrauchen und nicht handeln und einen Genozid gutheißen, dann müssen wir einfache Menschen, Christen und wer auch immer uns vereinen und die Wahrheit in die Welt hinausrufen, damit die Menschen sehen. Dann haben sie keine Rechtfertigung mehr in ihrem Gewissen. Lassen wir uns diese dramatischen Bilder und Zeugnisse zu Herzen gehen, damit wir wahre Menschen sind, Menschen nach dem Herzen Jesu, die den Hungernden, Armen und Verlassenen durch Gebet, Zeugnis und Tat je nach unserer Möglichkeit beistehen, gleichsam durch heroische Opfer wie die Ärzte im Gaza. Denn Gott hört die Gebete, welche aus der Tiefe unseres Herzens zu ihm aufsteigen, und er sieht die Tränen, welche die Menschen auf Erden vergießen, um der Gerechtigkeit willen. Und er wird, wie er uns verheißen hat, eines Tages, wenn die Zahl der Blutzeugen und Dahingeschlachteten auf Erden voll ist, Gericht halten über alle Völker. So dürfen wir im Antlitz der Gemarterten das Antlitz Jesu erkennen und denken wir an seine Worte über das kommende Weltgericht. Matthäus Evangelium Kapitel 25. Wenn der Menschensohn in seiner Herrlichkeit kommt und alle Engel mit ihm, dann wird er sich auf den Thron seiner Herrlichkeit setzen. Und alle Völker werden vor ihm zusammengerufen werden, und er wird sie voneinander scheiden, wie der Hirt die Schafe von den Böcken scheidet. Er wird die Schafe zu seiner Rechten versammeln, die Böcke aber zur Linken. Dann wird der König denen auf der rechten Seite sagen: Kommt her, die ihr von meinem Vater gesegnet seid. Nehmt das Reich in Besitz, das seit der Erschaffung der Welt für euch bestimmt ist. Denn ich war hungrig, und ihr habt mir zu essen gegeben. Ich war durstig, und ihr habt mir zu trinken gegeben. Ich war fremd und obdachlos, und ihr habt mich aufgenommen. Ich war nackt, und ihr habt mir Kleidung gegeben. Ich war krank, und ihr habt mich besucht. Ich war im Gefängnis, und ihr seid zu mir gekommen. Dann werden ihm die Gerechten antworten: Herr, wann haben wir dich hungrig gesehen und dir zu essen gegeben, oder durstig und dir zu trinken gegeben? Und wann haben wir dich fremd und obdachlos gesehen und aufgenommen, oder nackt und dir Kleidung gegeben? Und wann haben wir dich krank oder im Gefängnis gesehen und sind zu dir gekommen? Darauf wird der König ihnen antworten: Amen, ich sage euch, was ihr für einen meiner geringsten Brüder getan habt, das habt ihr mir getan. Dann wird er sich auch an die auf der linken Seite wenden und zu ihnen sagen: Weg von mir, ihr Verfluchten, in das ewige Feuer, das für den Teufel und seine Engel bestimmt ist. Denn ich war hungrig, und ihr habt mir nichts zum Essen gegeben. Ich war durstig, und ihr habt mir nichts zu trinken gegeben. Ich war fremd und obdachlos, und ihr habt mich nicht aufgenommen. Ich war nackt, und ihr habt mir keine Kleidung gegeben. Ich war krank und im Gefängnis, und ihr habt mich nicht besucht. Dann werden auch sie antworten: Herr, wann haben wir dich hungrig oder durstig oder obdachlos oder nackt oder krank oder im Gefängnis gesehen und haben dir nicht geholfen? Darauf wird er ihnen antworten: Amen, ich sage euch, was ihr für einen dieser Geringsten nicht getan habt, das habt ihr auch mir nicht getan. Und sie werden weggehen und die ewige Strafe erhalten, die Gerechten aber das ewige Leben. Herr Jesus Christus, Sohn Gottes, erbarme dich unser. Schenk uns demütige, reine, zerknirschte Herzen, dass wir in den Leidenden dein Antlitz erkennen und mit Liebe und aller Kraft für deine Wahrheit einstehen und für Gerechtigkeit auf Erden.